This is part 2 of my presentation, and I will be covering right hemisphere syndrome. So imagine if you have a patient that comes to you and you realize that he or she suffered a right-sided stroke. What do you do with this patient? How do you assess their symptoms? What should you expect? And how do you incorporate strategies to maximize your care with them? First, I want to talk about common symptoms of right-sided strokes. From a physical perspective, you might expect that they may experience left-sided motor weakness. Many also notice left-sided sensory loss. Very common is that many patients with right-sided strokes tend to experience left hemispatial neglect. That is, they completely forget about the left side of their body and their left visual field. From a cognitive perspective, individuals with right-sided strokes have problems with sustained attention. You might notice that they're able to pay attention early on, but with time, they become distracted. And you notice that they start to think about other things. For right-sided strokes, visual memory is a problem, unlike left-sided strokes where verbal memory is a problem. They have difficulty remembering visual information, so faces. They might have a hard time getting from point A to point B. In general, they have a difficult time with visual learning. It's also very common for individuals with right-sided strokes to exhibit visual spatial, visual constructional difficulties. And in a small percentage of patients who have right-sided strokes, they may also experience some temporal disorientation. So they might know who they are, where they were born, but they might have difficulty knowing the time of the day, or even where they're at, or why they're there. Those are some things to keep in mind. I do want to spend some time talking about social cognition and behavior, because this is highly associated with patients who've suffered right-sided strokes. So again, with these patients, they may have impaired recognition and expression of affect through tone of voice. They may not be able to pick up on your tone of voice that you're angry or even that you're upset at them. They often demonstrate impaired social judgment. So for example, where you and I might know that the person wants us to stop talking, these individuals might continue to talk and perseverate on the topic, even when it's clear that you think that it's time to go. It's common for individuals with right-sided strokes also to lack awareness and insight into their deficits. This is also commonly known as anosognosia, which I will discuss later. Apathy is another characteristic that is common, where you might find that patients really don't care, or they lack motivation or interest. They might also display flat affect, where by looking at their face, you can't tell how they're feeling or what they're thinking. Also, what's common is that individuals with right-sided strokes may often confabulate. A good example is when you highlight a deficit area and they will say, no, that's not a problem when I go home. It'll all be fine. Or it's because of the chair that you let me sit on. That's why I can't sit by myself. Again, consistent with these areas is with right-sided strokes, they show a lack of concern. They tend to take risks. and they tend to engage in more risky behaviors because they don't have insight or awareness into their level of deficit. Another example would be if the patient is told that they cannot stand or walk, they might do so because in their mind, those things aren't our problem. Or on the flip side, in terms of standing or walking in therapy, they might not want to do it because for some reason they'll have excuses of not wanting to do it. On this next slide, I do want to spend some time talking about right-sided neglect. This is a very common sequelae after right hemisphere damage. This is most often due to damaged posterior parietal lobe, in where the patient has an ability to respond or acknowledge stimuli in their left hemispace. So, for example, they might not attend at all to the left side of their body or any visual stimuli on the left side. In general, this is different from inattention, where it might just be that when they're reading, they don't necessarily focus on the things on the left side of the page, but they may be very aware of the left side of their body. This is a very common symptom after a right-sided stroke. Earlier, I talked briefly about anosognosia, and I want to spend a little bit more time talking about this because it is quite prevalent with right-sided stroke patients. This is where they lack recognition of their impairment. And again, to highlight, they might have left-sided neglect, left-sided sensory loss, and they may minimize the extent at which this is impacting them. Again, this is very common with both right hemispheric strokes as well as frontal lobe strokes. Let's move on now and switch gears. We're going to be talking about emotions right now. When we think about the right hemisphere, it's the part of the brain that helps us to recognize negative emotions more easily. So when there is a stroke in the right hemisphere, patients may have difficulty recognizing when you might be angry at them or when another person might be scared or fearful. So that's something important to keep in mind. Individuals with right-sided stroke tend to display pleasant mood. They might be talkative. However, often their tone of voice may be monotone. That you don't really notice any type of fluctuation in their tone at all. And as such, they may come across as being flat and even displaying flat affect, showing no emotion in their facial expression. So now that we've talked about some of the common sequelae after a right-sided stroke, I want to share with you some treatment strategies, some general ones that I take into account when I work with these patients. These are similar to the strategies that I use for individuals with left-sided strokes. As discussed, it's most important to try to control our environment to enhance patient care. I always see my patient in private, quiet offices or rooms. I always attune to both verbal and nonverbal communication. And again, since individuals with right-sided strokes may exhibit some visual memory problems and not recognize faces or recognize or remember visual information, I often supplement information by giving handouts, using gesturing, giving written information to them. I always try to maintain good eye contact in order to make sure that I have their full attention especially since with right-sided stroke patients, they may have problems with sustained attention. So if I meet with them for more than 10 minutes, I might lose their attention. Next, providing simple, clear, concise information. That I often find is very helpful across all stroke patients. And lastly, because right-sided stroke patients may have a tendency to perseverate or to not pick up on social cues, if I find that they're a bit off topic or confabulating or misinformed about certain things, I make sure that I use gesturing, gentle reminders, and provide accurate information for them. I redirect the conversation when it's necessary. Some additional considerations to take note when working with these patients is, again, using a multimodal approach to patient interaction. What do I mean by that? Model, demonstrate, instead of just talking out loud. Again, incorporate handouts, incorporate experiential learning exercises to enhance learning and memory. Again, since left hemispatial neglect is quite common, I want to make sure that during my first visit with the patient, I stand on the right side of where the patient is in order to ensure that they're fully incorporating what I'm saying to them and that they see me. Next, because anosognosia is so common with right-sided strokes, I make sure that in the back of my mind, I'm always assessing their level of awareness and insight into their deficits. Because if I find that they lack insight, in my treatment plan, I will incorporate ways to enhance that. We know that that leads to better outcomes and successful recovery. So from the beginning, right when I work with patients, I begin talking about long-term realistic goals. And I have ongoing education throughout the stages of the recovery in order to highlight their current abilities, their safety limitations, as well as their recovery trajectory. So my treatment approach is very direct, objective, and immediate. I find it very helpful to provide immediate, consistent feedback to these patients, especially when they feel like they don't have a problem. It's helpful to have objective data to show them how they performed in the moment. Sometimes I will have video recordings to help them see what I'm trying to convey. And it's most helpful to provide a well-organized program that, again, gives direct positive feedback in a consistent manner. That way, patients will learn immediately and take in what you say. Overall, as with all stroke patients, it's important to enhance their level of independence and provide opportunities to allow them to perhaps even fail at times so that they can work through some real life situations. Thank you.